This is a rather rugged looking wound, and it can look even ruggeder, if that is such a word, if we don't take proper care of this. This is a hard place to close up. It's an easy place to get infected. It's an easy place for bleeding to start. And therefore, all these odd stitches through here, obviously these are to pull the edges together, but what you can't see very well are some stitches along through here, which we call pucker stitches, that are used to control bleeding, in other words, prevent bleeding. These stitches may have to come out early. They're the ones that are on the upper side or the further part of the hand. These, if the area begins to get red, sore, and tender, they need to come out sooner. Now, almost always this part of the hand bleeds, so you can expect a fair amount of bleeding. There's no good way to dress this hand to prevent bleeding. Some places dressings can prevent bleeding, but in this case it's a matter of icing it down, not doing anything with your hand for the next 24 hours and nothing strenuous for the next 48 hours or even more. The importance of this can't be stressed too much, because once bleeding occurs, you're going to have a red, sore, tender hand, and it may be sore for weeks to come. So prevention is the most important thing.
When you start to feel the feeling come back in your wound, we will give you a glove. You need to put ice in it, chopped crushed ice, with a teaspoon or 2 teaspoons of salt to make the ice really cold. About every 15 minutes on the hour, you need to place the ice pack we give you on top of your bandage. The bandage stays on overnight, but you put this on top and do it 15 minutes every hour. And tomorrow the bandage comes off and you'll be able to get the wound wet with no soap. If you need to wash it, foamy shaving cream is the best thing to wash your wound with.